Cataract is a clouding of the lens. So the natural lens is basically clear in color. It's like clear water. However, as we get older, it becomes more cloudy. So just imagine like clear water and you pour some milk into it, then it becomes hazy. So that's how cataract is. And over time, it becomes hazier and hazier. So it will eventually affect our vision. Well, there are several causes of cataracts. However, the most common would be aging because of the lens proteins that gets deposited into the lens and then it becomes cloudy. However, we should also not forget that we also have like congenital cataract, wherein some babies can be born with cataracts already. And usually these can be caused by like infections of the mother while the mother was still pregnant. Or what we call hereditary. There are people who are in, their families or members of the families who get cataracts when they're still very, very young. Yeah. Sometimes also trauma can cause an early cataract. Inflammation of the eyes can also give us early cataracts, or use of some medications can also give us early cataracts. Early symptoms can be as subtle as just glare, or sometimes they would just say, oh, I'm starting to have some difficulty reading at night. When the lighting is not so bright, then it's starting to get more difficult to read. Glare when they're driving at night. But of course, the most common one would be blurring of vision, which will get worse over time. Well, a cataract is treated, there's only one way to treat a cataract. Basically, we have to remove the cataract and replace it with an artificial lens to make the vision become clear again. And of course, right now, the most modern way of removing cataract is through a suctioning technique. Laser is also being used already nowadays to remove a cataract. Well, one of the most common misconceptions would be we need to wait for it to ripen. Okay, that's an old thinking, because the old way of removing cataract is we have to make a big wound and then we have to remove the whole cataract. So if the lens is too soft, it's not that easy to remove the whole lens. But nowadays, because we're using a modern technology wherein we're basically doing suctioning, the softer the cataract, the better. So we don't usually want to wait for it to ripen, as a lot of people would use that word, because if it's very ripe, then it's very hard already. And if it's very hard, then it's more difficult to suction out and you might get more complications while doing the surgery. One of the other misconceptions is that eye drops can cure cataracts. Okay, so there's no eye drop that can cure cataract yet as of this moment. So everybody, once a cataract reaches a certain point wherein it affects the vision already, then you need to have surgery. Well, if it's affecting the person's lifestyle already. So I have patients wherein they would say, when you check them, their vision's actually not that bad, but they're so bothered by the glare. So if that's the situation, then you can also already consider removing the cataract. Of course, if the vision starts blurry, then that's no question. Yeah, you definitely it's indicated to remove the cataract already.